welcome to the Deep Dive. Today we're tackling a topic that's, well, sensitive for many, but understanding the solutions is really key. We're looking at penile injection therapy for erectile dysfunction. Our main source is a really clear video from Dr. Ryan Flannigan. He's a urologist specializing in this area. So, our mission, to cut through any confusion, pull out the essential info, and give you a solid understanding of this treatment, how it works, who it's for, and crucially, the safety stuff.
Yeah, erectile dysfunction, or ED, it's pretty common, actually, and it definitely impacts quality of life. Penile injection therapy, it's one option, a very effective, localized one, but understanding the details, that's really vital for using it safely and well.
Okay, let's unpack that.
Yeah.
If someone's hearing penile injection therapy for the first time, what's the basic idea? What are we actually talking about?
Right. Fundamentally, it's about getting medication straight to where it needs to act. It's also called intracavernosa injections, ICI for short. You're injecting a tiny amount of medicine directly into the erection tissue, the erectile tube, inside the penis.
A direct approach.
Exactly. Targeted for a local effect.
And the medications themselves, are there different kinds?
Oh, yes. It's definitely not one size fits all. That's important. Common ones are compounds like Trimix, Bimix, sometimes just prostaglandin, or even Quadmix. They're basically combinations of drugs that relax blood vessels.
Vasodilators, right?
Precisely. They help open things up, and the response is usually pretty quick. You'll often see an erection starting in, say, 5 to 10 minutes. Once you find the right dose for you, it generally lasts about 30 to 60 minutes, which is, functional.
Okay, now here's something I found really fascinating. This treatment doesn't need nerve function to work. That seems like a huge deal.
It absolutely is. That's probably one of its biggest advantages. Because it works directly on the tissue and blood vessels, it bypasses the whole nerve signal pathway that pills often rely on.
So for someone with nerve damage.
Exactly. Think about men after prostate surgery, a prostatectomy, especially if the nerves couldn't be spared. Or other pelvic surgeries, or even certain conditions like diabetes where nerves can be affected. This therapy can still work very well for them. It can be, well, life-changing in some cases.
So how does that work mechanically? You inject the medicine, then what happens inside?
So the medication acts right there, locally, in the shaft. It does two main things: increases blood flow into the penis, and crucially, it relaxes the smooth muscle tissue within those erectile chambers.
Relaxation is key.
It's essential. That relaxation allows the blood to get trapped inside those chambers. So blood flows in, gets trapped, the penis expands both length and width, and you get a rigid erection. And because it's so localized, you generally don't get side effects elsewhere in the body.
Right, that makes sense.
Yep.
Okay, so thinking about who this is for, who's the typical candidate, and, just as vital, who should maybe steer clear?
Good question. Often it's someone who's already tried other things. Maybe the oral pills, Viagra, Cialis, Levitra, those PDE5 inhibitors didn't work well enough, or maybe they cause side effects. Or perhaps they tried a vacuum device and didn't like it or didn't get the results. So it's often a second-line or even third-line therapy.
You mentioned prostate cancer survivors earlier. Are there other specific groups?
Yes, definitely. Prostate cancer survivors are a big one, especially if nerves were affected. Also, survivors of other pelvic cancers. And it's sometimes used for something called penile rehabilitation.
Penile rehabilitation.
Yeah, the idea there is after surgery or certain treatments, using injections regularly can help keep the erectile tissue healthy by promoting blood flow and oxygenation, even if spontaneous erections aren't happening yet. It sort of maintains the tissue health.
Interesting. Okay, now, the flip side, contraindications.
Yeah.
Who might not be a good fit?
Well, the main things are practical and safety related. If someone has significant issues with dexterity, trouble with fine motor skills in their hands or fingers, doing the injection safely and accurately could be a real challenge.
Right, you need to handle the syringe precisely.
Exactly. Also, anyone with a significant bleeding disorder needs careful consideration. There's always a small risk of bleeding at the injection site, so that needs to be discussed thoroughly with their doctor.
Okay, let's pivot to the practical side. This isn't like taking a pill. There's a learning curve, preparation. What does that look like?
Absolutely. This needs proper teaching. You don't just get a prescription and figure it out. Usually, a urologist or a sexual health clinician, maybe a nurse specialist, will provide detailed, hands-on instruction. That's crucial.
So what supplies would someone need to have ready at home?
Right, so you'd have the medication itself that's often kept refrigerated, but you take it out a bit before injecting. You need the syringe with the correct needle, alcohol swabs for cleaning, and really importantly, a sharps disposal container for the used needles. Pharmacies usually provide those.
And information too, I assume.
Oh, definitely. You get an information package. This is vital. It includes your specific dosing chart, how to start, how to adjust if needed, detailed steps for the injection, safety points, and, critically, what to do if an erection lasts too long. You should also have Sudafed pills on hand, just in case, for that prolonged erection scenario.
Practically setting up.
Yeah, just having a clean, flat surface helps a lot. A nightstand, bathroom counter, somewhere to lay everything out neatly. The whole process is generally taught in 3 clear steps. Prepare the meds, prepare the site, deliver the injection.
Let's walk through the principles of those steps. Not a full how-to, obviously that's for the doctor, but what's the essence of preparing the medication safely?
Right. Principles and safety first. Hand washing is step 0, really.
Yeah.
Clean environment. Then cleaning the rubber stopper on the medication vial with an alcohol swab that's key to prevent contamination.
And the syringe itself.
Understanding the syringe is critical. Knowing the units, usually 0 to 100, seeing the little hash marks, often 2 units each, and how the top of the plunger lines up with the number for your dose, like maybe starting at 5 units. Then drawing it up. The technique involves pulling back the plunger to draw in a little air first. You take the cap off the needle, stick it into the vial's rubber top, and inject that air in. That prevents a vacuum, makes it easier to draw the liquid out.
Okay.
Then you flip the vial upside down. The advice often is to push any drawn-up medicine and air back into the vial first. This helps get rid of tiny air bubbles, then pull back slightly more than your dose, and finally, carefully push the plunger forward to the exact dose mark, checking again for bubbles. Precision is key.
And handling the needle afterwards.
Super important. Safe recapping, if you recap at all. Some recommend immediate disposal. One technique is resting the cap on the table and guiding the needle in. The absolute rule is, if that needle touches anything else, the outside of the cap, your finger, the table, it's considered contaminated. You discard it in the sharps container and start over with a fresh needle and syringe. No shortcuts on sterility.
Got it. Sterility and precision. Now, step 2. Preparing the injection site on the penis. What are the core guidelines there?
The absolute #1 rule is knowing where not to inject. Avoid the top midline, that's where major nerves and blood vessels run, and avoid the bottom midline, that's where the urethra, the P channel is. You don't want to hit those.
So where do you inject?
The safe zones are on the sides of the shaft. Imagine a clock face looking down. Somewhere between 2 and 3 o'clock on the right side, or between 9 and 11 o'clock on the left side, usually around the middle of the shaft, not too close to the base or the head.
And the technique?
You use your non-dominant hand to gently grasp the head of the penis and pull it slightly away from your body, making the skin taut. Then take an alcohol swab with your dominant hand and clean that entire side of the shaft where you plan to inject. If uncircumcised, you'd retract the foreskin first, then grasp the head and clean.
Okay, site prepped. Then step 3, delivering the injection. Key principles.
Needle cap comes off. You hold the syringe correctly, often like a dart, with fingers on the barrel, thumb ready but maybe off the plunger initially. With the penis still held taut by your other hand, you insert the entire needle straight into the side, into that target zone, with one quick, deliberate motion.
All the way in?
Yes, the full needle length. This ensures the medication gets deep into the erectile tissue, the corpus cavernosum. Once it's fully in, you reposition your finger onto the plunger, double-check the needle hasn't slipped out slightly, and then steadily inject the medication. After injecting, you smoothly withdraw the needle. Set the syringe down safely, maybe on the table for a moment. Then immediately apply firm pressure to the injection spot with your finger or thumb for about 1 to 2 minutes. This minimizes any bruising or bleeding. And finally, that used needle goes straight into the sharps container. Done.
It sounds very methodical.
It is. And while, like you said, it might sound daunting, patients usually find that with the proper training and a bit of practice, it becomes quite manageable. The routine and the positive results often outweigh the initial apprehension.
Right, so let's talk about those results. What's the actual goal here? What kind of erection are we aiming for, and is there a time limit?
The goal is simple. An erection that's rigid enough for satisfying sexual activity. It needs to be usable. But there's a really important safety aspect regarding duration. The ideal is for the rigid erection to last less than 60 minutes.
Less than an hour. Why?
Because erections lasting much longer than that, especially rigid ones, start to increase the risk of a condition called priapism. That's a prolonged, often painful erection, and it can be harmful.
Okay, that brings us to dosing. You mentioned a dosing chart. How does that work, and what's the big warning about adjusting the dose?
Right, the dosing chart is your guide. provided by your doctor. It tells you where to start and how to cautiously increase the dose if the initial one isn't quite effective enough, usually going up by very small increments. The huge warning, the absolute don't, is do not aggressively increase the dose beyond what that chart says or what your doctor advised. Trying to get a stronger or longer erection by just taking more significantly raises the risk of priapism.
So priapism, let's define that clearly. You said prolonged erection.
Yeah.
How long is too long, and why is it actually dangerous?
Medically, priapism is usually defined as an erection lasting 4 hours or more. And it's dangerous because the blood trapped in the penis isn't circulating properly. It becomes low in oxygen. This is called ischemia.
Lack of oxygen.
Exactly. The cells in the erectile tissue start to starve for oxygen. If this goes on for more than 4 to 6 hours, those cells can actually start to die. This can lead to scarring, fibrosis, making future erections difficult or impossible, and it can be extremely painful. It's a genuine medical emergency.
That sounds serious. Okay, prevention first.
Right.
What are the absolute must-dos to avoid getting into that situation?
Non-negotiable rules. Number 1, never take more than your prescribed dose, ever. Number 2, do not combine injection therapy with other ED meds, especially the pills like Viagra or Cialis, unless specifically instructed by your specialist, which is rare. The combination can be dangerous. Limit injections to no more than 3 times a week. And critically, never inject more than once in a 24-hour period. If an injection doesn't work, you absolutely cannot just do another one right away. You have to wait a full 24 hours before trying again.
Crystal clear. But okay, let's say, despite following the rules, someone finds their erection isn't going away. What's the step-by-step plan then?
This is the emergency action plan, and knowing it is crucial. So, clock starts from the injection. If after 1 hour the erection is still fully rigid, the advice is usually to try and achieve climax if possible. Gentle physical activity like walking up and down stairs or a cold shower might also help sometimes.
Okay, 1 hour mark actions. What if it's still there after 2 hours?
After 2 hours, if it's still rigid, the standard recommendation is to take Sudafed, specifically 4 tablets of the 30 milligrams pseudoephedrine for a total dose of 120 milligrams. Now, the huge caveat here, you must clear this with your prescribing doctor beforehand.
Yep.
Make sure Sudafed is safe for you, that you don't have high blood pressure or heart issues or anything else that would make it risky.
Vital check beforehand. Okay, Sudafed at 2 hours. What if that doesn't work? 3 hours in.
If you reach the 3-hour mark and the erection is still fully rigid, you need to go to the nearest emergency department. Immediately. Don't wait. Time is tissue here.
Go straight to the ER. What do you tell them?
You tell them exactly what happened. I use penile injection therapy for ED. I injected medication name at time. It's now been over 3 hours and the erection hasn't gone down. I'm under the care of Dr. Urologist's name. Giving them that info up front helps them act quickly.
What do they typically do in the ER?
Usually the first step is an injection of a different medication called phenylephrine into the penis. That often counteracts the effect of the first injection and resolves the erection fairly quickly. If that doesn't work, they might need to aspirate, meaning use a needle to drain some of the trapped blood. More invasive surgical options are really quite rare, especially if you get there promptly, close to that 4-hour mark. Acting fast is key.
That step-by-step plan is incredibly important. It feels like this deep dive really covered the whole journey, the why, the how, the who for, and critically, the what-ifs. Understanding the mechanics, the practical steps, and especially the safety, like managing priapism risk, seems absolutely essential.
It really is. And thinking bigger picture for a moment, what does this detailed look at something like penile injection therapy really show us? I think it speaks volumes about personalized medicine today. It highlights just how critical patient education is and how empowering patients to manage their treatment carefully with guidance leads to better, safer outcomes, especially for these really sensitive health issues where good communication is everything.
That's a great point to end on, the power of informed self-management under guidance. Thank you for joining us on this deep dive.